Our patient is a 48-year-old woman who, after having a few kids, does not like all of this extra skin and the fat of her lower tummy. So we're going to perform a tummy tuck on her to get rid of that. We're also going to do some liposuction out here to help with her hips as well. All right, these are the markings for our surgery. We're going to make a hip-to-hip incision, and the goal is to remove all of this extra skin. And you can see there's a good amount. We're also going to do some liposuction on her back and her waist and her hips as well to get rid of some of her extra fat there. Here's another look at her markings now in the operating room. The plan is to make an incision from hip to hip to lift everything all the way up to the bottom of the breastbone, pull it down, and remove all of that extra skin. Okay, her surgery is all done. She did really, really well. We took a lot of skin off of her. She does have a hip-to-hip scar. You can see here, all the little wrinkles that you see here, those will all go away. There's also a little scar around her belly button, and we did a bunch of lipo on her sides as well as her back. And this is all the skin that we took off of her. It's several pounds worth. You can see where she had some previous scars and things like that. We are 7 weeks out of her surgery and she's healing really, really well. She does have a scar that goes from hip to hip, and there's a little scar around her belly button. She's still a little swollen, but the swelling is going to continue to come down as the weeks and months go by. She's healing really, really well, and everything is about as nice as could be hoped for at this point. Next step is in about a month we're going to have her start doing some abdominal exercises. That's going to help get a bit more definition in her abdomen as well.